I'm Jed, and this is my colleague Sue, who will be talking to you shortly. First of all, this is an amazing opportunity for us, and we're absolutely delighted to have been invited to give a brief presentation on Northside House, who we are and what all this is about and what does it mean to us. What I wanted to, I'm a nurse. I've worked in the criminal justice system and for the NHS for almost 40 years. That's an odd concept to me, and I'm in complete denial. But however, within that time, I've seen some amazing things, particularly in the prison system, but also in psychiatry. So this is an incredibly important moment for us. So today I thought it would be useful to put some context into what our art project at Northside House is about, and hopefully describe the importance of this unique opportunity, certainly for our service users, and Sue will talk about that shortly, but also for families and for carers, for the communities, and in particular our partners who can help us realize some of our aspirations and our dreams. I guess we should start with who are we? So Northside House is a hospital in Norwich, formerly known as the Norvic Clinic. It's a secure psychiatric hospital, which means that not only are people trying to improve their mental health and travel quite a difficult, challenging journey of recovery, but also find themselves in a sort of paradox, if you like, in this particular arena. Not only do our service users have to navigate the clinical elements of their recovery, but also the political, social and legal challenges. And it is indeed a complex landscape which will test anyone's resilience and also hopes for recovery. What are some of the immediate challenges for people in this environment? Well, it's an institution. I'm sure that everyone knows, has a pretty good idea or insight into institutional life. In the institution, custom and practice is king. Routines rule, and regulation brings about blanket rules, which can very, very quickly establish a static situation, a vacuum. It can lead to a vortex if we stand still. We have to constantly challenge some of the vagaries and the pathology of institutional life. If we don't do that, then we very, very quickly find ourselves in a very sort of backward and negative place. If you could imagine suddenly one day finding yourself in this environment, it's probably the closest thing to a sort of living nightmare that you could possibly imagine. There's been something in David Cutler's keynote presentation was gave us a fascinating brief history of the political landscape, and I thank him for that. It was really, really interesting. But also Simon talked about the environment, which has a significant impact on people's well-being and recovery. And that's everyone. It's the service users, it's the people that coexist with the service users, the staff, and certainly the families who come along in the hope that their loved ones are going through a caring and genuine and sincere process. So the environment is incredible. So what I'm trying to describe here is a closed world, very difficult for some people to imagine having all those restrictions imposed on you, and you having to live to the routine and ask permission to do an awful lot of things. I went to an exhibition at the Wellcome Museum down in London a couple of years ago. It was an incredible museum. Some of the things that Simon touched on was very much a part of that museum. But at the end of it, there was a designer asylum, and it was the vision that service users had for a safe place to recover. And I guess, and I was really quite inspired by that. And I always have been inspired with what comes out of this incredible situation that people find themselves in. And that's the beauty for me of art and dance and music. And these are the things that help connect this internal world, this inward looking world, to the outside world, and to the possibilities of recovery and self-expression, and hope. I met Hospital Rooms a couple of years ago down in Sussex, and I was absolutely blown away with the energy, with the artists, with the real hope that they had for people. And we were very, very lucky to maintain that contact over the last few years. And so just over a year ago, Tim and Neve talked about the possibilities of linking up with the university. We've had a beautiful collaboration in a very short period of time, a very sort of powerful relationship, and everything is about relationships. And what these organisations and the artists bring to this closed world of Northside House is the hope and the inspiration and fresh relationships for a life in recovery, and an opportunity to really express their hopes and hopefully that link with the outside world. I've already gone over my little time allocations for this. It's
all right, nothing new, Jed. Nothing new.
I'm looking forward to the rest of the day, and hopefully chatting to some of you guys later. I'm going to hand you over to my wonderful colleague now, Sue Pashley.
Hi everyone. So as People Participation Lead for NSFT Secure Services, I sit on the leadership team, and I'm in a privileged position to be able to bring to the role 5 years lived experience of inpatient services, including secure care. So the main focus of my role is quality improvement and specifically patient experience and outcomes. Living with, managing, and for periods of time battling with the relentless grip and torment of mental illness is hard enough. But then add to that the challenge of lengthy detainment, and every minute and every day becomes hopeless and often unbearable. Those 5 years detained were the darkest of my life. Days were filled with fear, confusion, paranoia, emptiness, shame and uncertainty. A world where I was confined in space, where time stands still, and where the focus of your thoughts and emotions are intensified. An environment driven by routine, but where there is little to fill the 24 hours a day, 7 days a week, and where the physical space is often stark, cold and clinical, where walls are whitewashed, tired and uninspiring, just a trapped space where there's no escape from it, no respite from it. It is the relationship and the interactions and the opportunities within the environment that help us support recovery. And I've often questioned and reflected on what helped me move forwards from the incredibly dark place, rocking in the corner of a seclusion floor, where the aspiration I had was for nothing more than to be removed from the service in a wooden box. And how did I get to a place to be more hopeful about recovery and discharge being a possibility? For me and for many, it can be found in the connection with people, with the arts, and opportunities for creativity. Once a week, a space to mindfully explore creatively, whether throwing a pot, painting, drawing, weaving, sculpting, flower arranging, creative writing, poetry, or photography. It was a place to channel my emotions, to express my intrusive thoughts in a way that felt safe to me. It was a medium for expression and for escape. My involvement in the Kessler Awards were particularly important milestones in my recovery. The art room became my solace. It was a place where I felt more hopeful and understood, where I felt free of judgment. Now I find myself on the cusp of a unique opportunity to work collaboratively with colleagues and with artists, and most importantly with service users, to transform a space within a service, to provide inspiration, colour and opportunity. I know personally that this project and this journey we will work together to create an arts and a social space, which will be life-changing, life-enhancing. What feels so important to me is the knowledge that we're creating a space that will become the heartbeat of our service, pumping out hope, light, colour, inspiration, and a philosophy focused on recovery, expression, new beginnings, freeing people from the shackles of detainment, diagnosis, risk, and hopelessness. It will help us as a service to provide a space and an opportunity to connect better with the patients, with their loved ones and their family, and probably more importantly, our community. Breaking the stigma of a secure service as a stark place where we detain the criminally insane, but instead a space where the talents can flourish and where we can connect healthily with the outside world. I cannot underestimate to those people on the call the potential impact of this piece of work on the service users' lives, on the staff's environment, and the hope for new beginnings and for change. And I'm incredibly proud to have come on the journey myself, to be in a position to be able to share this opportunity with our patients and to finally give them some hope that from a dark place they can find new beginnings and be inspired by the artists that have given up their time and space to do something really special with our service. And Jed and I feel incredibly proud to be involved in this project, and we know the potential for it to be life-changing. Thank you.